When people have the HipTrac at home, it really depends on the severity of their arthritis and how much pain they're in. So in the beginning, as we talked earlier about wanting to accumulate this manual therapy to maintain effects, in the beginning, if somebody does the HipTrac, they're on it, it feels good, they get up, they walk back and forth, and they're like, wow, this feels really good, I'm so excited. And then I have to be the guy with the bad news that says, well, don't get too excited because it was your first time. That pain's gonna come back probably within the next 5 or 10 minutes. And so the good news is that we tell them is that, again, remember those antibiotic analogies. The more you use it, the more you accumulate the amount of time that you can have relief. And so in the beginning, we'll have those people use it 1 to 3 times a day. Now it depends on their work schedule and their specific situation. But if you can use it 1 to 2 a day or up to 3 times a day, we'll have people start with shorter pulls. So they'll pump up to a certain level and they'll hold it for a minute or two. And then they'll come back down for 5 to 10 seconds, then go back up for a minute or two. And we'll start with like 6 to 8 total minutes of traction in that cycle. You really want people to start off slowly and get used to it. Just like if you're training for a marathon, you wouldn't go run 20 miles your first day. We want people to start with that 1 to 2 mile jog and work up. So we give them some of these analogies to help them understand that clearly. But as time goes on, then the person can use it, they can pull for 5 minutes at a time, come back down for 5 or 10 seconds, go back up for 5 minutes, and they can do this 3 or 4 times so they can work up to a good 15 to 20 minutes of total traction time during that session. We also tell people they want to know how hard should they pull. Well, we know through research that the harder you can pull and feel good about, the better it is for you. But again, you have to work up to that. You don't want somebody cranking right away. Now let's say they make a mistake and they do crank right away and they pull too hard. It's not dangerous. You're not going to dislocate your hip. It's very safe. The hip joint is super strong, but you can make your hip sore and irritated. And so it's temporary, and so we don't like people to do that, and they will make some mistakes in that. But the good news, the peace of mind they have is those mistakes aren't dangerous. It's just a matter of, okay, you got to ice your hip, you may have to take medication or whatever you can do to calm it back down, and then you get back on the horse, and you just try to make sure you're careful in how you take that up. So the provider, their healthcare provider, will instruct them through that dosage. But what happens is once people have been using that for 2, 3, 4 weeks, and now they've been using it 1 or 2 a day for those 15 or 20 minutes, what they'll commonly tell me is that the relief would only last 5 minutes in the beginning, but now they're getting 2 or 3 hours of relief, and then they're getting 6 to 8 hours of relief, then they're getting 2 days of relief. And so as people use it over the years, we find that not only are they getting more active because they're feeling better, they're getting stronger because they're able to exercise in less pain. And now they use the HipTrac 1, 2 a week, again, to keep that momentum going. Because it will want to tighten back up on them again, but they don't have to use it obsessively like they did in the beginning, which is really nice. And I suppose that's true for almost any workout routine. In the beginning, it's really important if you're lifting weights or exercising that you accumulate consistent effects. And then, then you can take a week off and probably not lose too much. So early on, it's important they're more consistent with it, but then they can start to learn for their individual case how to spread that out just to keep small doses going on that mobility.